Dr. Anthony Fauci warned of, quote, really serious consequences from reopening the economy too quickly. Testifying before a Senate committee Tuesday, the government's top infectious disease expert said there will be inevitably more COVID-19 cases as states and cities reopen, but a rush to do so might lead to outbreaks that could cause unnecessary death and hamper economic recovery. Kentucky Senator Rand Paul, who had COVID-19 last month and wants schools across the country to reopen in the fall, told Fauci that the decision should not be entirely up to him.
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision.
Fauci pushed back, saying, quote,
I have never made myself out to be the end all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence.
Okay, let's jump into the opinion zone. See what our panel thinks of Dr. Fauci and Rand Paul's exchange today. Joining us, Bill Caruso, attorney and Democratic strategist, and Republican strategist, Jeanette Hoffman. Bill, I'm going to start with you on this. I don't know that Fauci has claimed to be the only voice, but it seems that government is reacting only to Fauci's advice.
Sure. And listen, in some cases, I think in the outset of this, it was appropriate. We were in the middle of a healthcare crisis and we needed to surround ourselves with healthcare experts. And listening to healthcare experts on what we should be doing to address the healthcare crisis is important. And that continues. But there are other voices now that need to be heard and need to be part of the equation. We are in an economic crisis now, and that's going to have just unbelievably devastating impacts. And I don't know where it became a problem in this country to listen to smart voices, whether they be from the healthcare aspect and sector or from an economic sector. We should be synthesizing good advice now to figure out how to protect our country and globally, but also how to get the economy started. They're not mutually exclusive. So I think it's a good discussion. We should have more people talking.
And, I've heard some medical professionals say that not reopening the economy, not getting things back to at least a new normal also has medical consequences. Kids aren't getting vaccinated. There are people not getting elective surgeries. There are cancer patients not getting treatments. People will die if things stay closed. So it is a balance, right? And I do respect Dr. Fauci. I understand his comments, and there could be a second wave if things aren't done in a right way, but there has to be a balance. And, one of the issues I have a problem with is, the data. They say, look at the data, look at the cases. But a lot of the data is coming from long-term care facilities, Bill. That's not the general public. So, I think the weight of the long-term care facilities, let's take that out of the numbers. Let's look at the number of the public cases, the general public, and then use that to make the decision.
Well, the lockdown was supposed to help us treat the sick and protect the vulnerable. And in New York and New Jersey, neither happened. So you can make a very strong argument the lockdown was a total disaster. We'll see what happens. Thank you, guys.
Thanks, Bill.